Hi, I'm Alison and I'm having a chat today to my friend Andrew, who's a psychologist with See Hear Speak Psychology in Newcastle, and I'm a speech pathologist with Newcastle Speech Pathology. And we've just been having a chat about some of our shared client groups. And what I wanted to ask you about, Andrew, is that we're seeing it more and more are young people, and particularly small people, who are experiencing quite high levels of anxiety. Maybe can you spend just a minute or two talking about what that looks like for parents and what we can do to help our little people and older adults?
Yeah, absolutely. So, I mean, anxiety today, it's almost epidemic proportions, and it's often talked about. And often poorly understood, I've got to say as well sometimes. So most psychologists will be seeing kids as young as 3 or 4 years of age, up to teenagers and much older adults as well with anxiety. Look, I guess just some big things to think about with anxiety is often we're not really good at recognising it when it's there. Despite all this awareness and education, people still aren't, I don't think, that great at recognising it. So often a lot of our anxiety is actually stored in our body. So if you kind of do like a body map, it actually affects us in lots of different ways, from our breathing, to our heart rate, to clamminess, to getting sweaty. Just in our body alone, it affects us in a lot of different ways. The other way we don't tend to recognise it so well is we actually put in our lives a lot of coping mechanisms to try and deal with anxiety, but often we don't even realise that we've put those things in place. So people go to food, they go to risk-taking behaviours. There's lots of things we try to do to try and sort of cover up the anxiety underneath. I guess what I notice particularly, and this is particularly for young boys, is that you see a lot of anger come to the surface. So often you get this defensive emotion of anger pushing people away, but really underneath the primary emotion they're feeling is anxiety. And sometimes kids feel anxious about all sorts of things. They sometimes feel anxious about their parents, anxious because they're getting bullied, and now through social media we're seeing a whole new wave of cyberbullying and how that impacts kids as well. So often as psychologists, we just really start simply by helping people identify the anxiety, where that's affecting them. We help them work through their thinking around it, their behaviour around it, and importantly, their relationships as well, and what that means as well. So there's a lot of research to say highly anxious parents are going to have highly anxious kids. So often we need to work with everyone around that child to help the child's anxiety themselves.
Yeah. Do you have any tips particularly for parents of what we can do for our anxious children?
I think it's great if you can get in to see a health professional like a psychologist. Go and see the GP. Don't be afraid to talk about it. I think there's still a stigma out there, but it's good to talk about. And you know what? Often people around us have got some really valuable feedback. They can see things that sometimes we can't see, and if it's done in the right way, we can really help. Kind of change that. Often it's just changing those little things that makes a big difference. And often with anxiety, you got to face it. You got to face your fears, but it's how you do that that's important. And often it takes gradual, slow steps to get there. Some people still work with jumping into the deep end, but that's not needed. Those are the kinds of things, the places I'd start.
Great, thank you. Well, if you would like to find out more about how psychology can help your child with anxiety and how speech pathology can help you on your journey, then please get in touch with us. We would love to have a chat to you, and if we're not in your area, we can certainly connect you with great therapists who are.